According to Shannon L. Alder, the true definition of mental illness is when the majority of your time is spent in the past or future, but barely living in the realism of now. All of us have experienced nervousness or sadness in our lives. The nervousness and sadness becomes a mental illness when it is extreme and persistent. I personally have experienced mental health issues, and because of this, I have done research to further understand mental illness. Therefore, there are many forms of mental illness, and there is stigma about mental illness today. I will discuss what mental illness is and its treatments, the types of mental illness, and mental health issues today. As for what mental illness is, according to a 2022 website called What is Mental Illness is defined as a health condition that includes alternating in mood, behavior, thinking, and feeling harmed or distressed functioning. It affects daily functioning such as doing productive activities, having healthy relationships, and the ability to change and cope with adversity. Mental illness causes significant changes in thinking, emotion, and behavior, and causes distress and problems functioning at work, school, etc. As for the diagnosis and treatment, according to the website named What is Mental Illness, mental diagnosis involves a full health evaluation, including a physical exam. The need for treatment takes into consideration how severe the symptoms are and how much symptoms cause distress. Some of the treatment services include outpatient treatment services, inpatient treatment services, and use of any psychotropic medication. Sometimes psychotherapy and medication are used for treatment. The combination of therapy and medicine is the most effective. Now that we've learned about what mental health is, we'll now transition to the types of mental illness. Common mental health issues today include anxiety and depression. According to a 2016 article called Common Mental Health Issues, anxiety disorders are diagnosed when fear is so significant that it affects one's daily functioning and has occurred for a long period of time. Depression is diagnosed if a low or sad mood has lasted for a period of 2 weeks or longer. There are many types of anxiety disorders, including panic disorder, social anxiety disorder, and generalized anxiety disorder. As for bipolar, schizophrenia, and eating disorders, according to a 2023 website called Types of Mental Health Issues and Illnesses, bipolar disorder is when a person feels episodes of mania and depression. People with schizophrenia have disruptions in thinking and emotions and have a distorted sense of reality. Eating disorders include anorexia, bulimia, and binge eating disorders. People with anorexia severely restrict their diet and have an intense fear of gaining weight. People with bulimia eat a large amount of food and then purge it through means of vomiting, taking laxatives, fasting, excessive exercise, or using medicines inappropriately to lose weight. People with binge eating disorder have episodes of binge eating, which involves eating largest amount of food in a short period of time. People with binge eating disorder don't typically try to purge. Now that we've learned about the common types of mental illness, we'll now shift to mental health issues today. As for teen mental illness, according to a 2018 article called It's Time to Confront Student Mental Health Issues Associated with Smartphones and Social Media, a survey of students in the last 12 months reported that 41.5% of students felt things were hopeless, 51.8% felt very lonely, 55.3% felt overwhelming anxiety, and 33.5% felt so depressed it was difficult to function. According to a 2016 article called Teen Mental Health First Aid, a description of the program and an initial evaluation, half of all people who experience mental illness will have their first episode at age 18. It's estimated that 1 in 4 16 to 24-year-olds will experience a mental illness in any 12-month period. Only a minority of young people with clinically significant symptoms of mental illness ever seek professional help. As for the mental health stigma, according to a 2011 article called Mental Health Stigma About Serious Mental Illness Among MSW Students, Social Contact and Attitude, stigmatization has many bad effects, including refusing to seek treatment, decreased quality of life, fewer job opportunities, decreased opportunity for getting housing, decreased quality in healthcare, and decreased self-esteem. According to the 2013 article called Combating the Mental Health Stigma with Nostalgia, In a survey, 11% of the respondents said that they didn't want to live next to someone with mental health issues. People with mental illness are treated as less human because of the stigma. Because of the stigma, mental health problems are often underestimated, underdiagnosed, and untreated. Mental health stigma can be a barrier to success in friendships and at work. In conclusion, there are many different types of mental illness that can affect anyone. Overall, mental illness is a change and disruption in one's mood and behavior. There are many treatments and types of them, and mental health issues have changed today. In summary, there are many different types of mental illness that need to be treated, and the way it is treated has changed. In essence, mental illness affects the way people think and feel and may change one's behavior. Thank you.